So there are a number of applications for new technologies in improving and closing the gap between developed and emerging economies in terms of healthcare. But most important is the ability to extend the reach of preventative services and primary care into populations that are in more rural areas and ensure that they're getting the right care to close off disease pathways before they even emerge. So it's a real opportunity to make it more efficient, more effective, and with greater reach into at-risk populations around the world. I think one of the great things today about the way technology is evolving and how innovation is pushing it forward is that it actually enables government to deliver healthcare services much more cost effectively on a patient-by-patient basis. So the reach, the scale, the economies of scale in terms of pricing really allow us to get a much more efficient provision of service by governments to their populations in today's world. So AI is helping us with faster diagnosis, which allows us to get care faster to patients and to citizens, and that helps us lower the cost overall of how we provide healthcare to our populations. So public and private collaboration is absolutely critical when it comes to addressing global health challenges. So if you take, for example, pandemic awareness and prevention, one of the things that has to happen very quickly is the sharing of data between governments and the private sector, leveraging of technologies like AI to develop vaccines that can move in close proximity to how diseases are evolving, and that can only happen between strong public-private partnerships that enable the private sector to develop technologies to meet the needs as they're emerging, using the basis of data that the governments have access to in a way that's safe for the populations, protects their privacies, but still enables us to move quickly and nimbly in a rapidly evolving healthcare landscape today.